I'm OnyekaGOD, your explainer. Understanding the body's electrical storm is, well, the first step in making sense of convulsions. A convulsion is a sudden, uncontrolled electrical disturbance in the brain. It can cause your body to shake rapidly and uncontrollably. Think of your brain as a complex electrical grid, with signals constantly firing to control everything you do, from breathing to walking. Normally, these signals travel in an orderly fashion. During a convulsion, however, this system experiences a surge, like a power grid being hit by lightning. This sudden burst of abnormal electrical activity disrupts the brain's normal function, leading to a temporary loss of control over the body's muscles. These events can be frightening to witness, but understanding them is the first step toward managing them effectively. The symptoms of a convulsion can be quite dramatic and are important to recognize. The most common sign is the shaking or jerking of the arms and legs, often called convulsions. A person might also lose consciousness or awareness of their surroundings. You may notice them staring blankly into space, or their eyes might roll back in their head. Sometimes there can be a loss of bladder or bowel control. Following the event, the person is often left feeling confused, tired, and may have a headache. These symptoms are the outward signs of the intense electrical storm happening inside the brain, a powerful but temporary disruption to its normal, delicate balance. So, why do these electrical storms happen? Convulsions are a symptom, not a disease in themselves. They are the result of an underlying issue that affects the brain's delicate circuitry. Many different conditions can trigger a convulsion. One of the most well-known causes is epilepsy, a neurological disorder characterized by recurrent seizures. However, not everyone who has a convulsion has epilepsy. Other triggers can include a very high fever, especially in young children, which is known as a febrile seizure. Head injuries that cause trauma to the brain can also disrupt its electrical pathways and lead to a seizure. The list of potential causes is broad, highlighting how sensitive the brain is to changes in the body. Infections that affect the brain, such as meningitis, can be a serious cause. Certain medical conditions like a stroke, which interrupts blood flow to the brain, or a brain tumor, can also provoke convulsions by putting pressure on or damaging brain tissue. Furthermore, withdrawal from alcohol or certain drugs can severely disrupt the brain's chemistry, leading to a seizure. Even a significant imbalance in the body's electrolytes, such as very low blood sugar or sodium levels, can be enough to trigger this intense neurological event. While not all convulsions can be prevented, especially those linked to genetic conditions, you can take practical steps to lower your risk. It all starts with protecting your brain. Always wear a helmet during activities like cycling and skateboarding, or playing contact sports to prevent head injuries, which are a significant cause of seizures. Similarly, using seatbelts in vehicles is a simple yet crucial habit that can protect you from traumatic brain injury. These measures are your first line of defense, creating a physical barrier to shield your brain from harm. Managing your overall health is another cornerstone of prevention. If you have diabetes, keeping your blood sugar levels well controlled is essential, as sharp drops can trigger a convulsion. For those with high blood pressure, following your doctor's treatment plan can reduce stroke risk. A balanced diet, regular exercise, and adequate sleep all contribute to a stable internal environment. Think of it as maintaining your body's infrastructure to ensure your brain's electrical grid runs smoothly. For individuals diagnosed with epilepsy, taking prescribed anti-seizure medication consistently is the most important preventive measure. These medications stabilize electrical activity in the brain and are highly effective when used correctly. Missing a dose can significantly increase seizure risk. It's also vital to identify and avoid your personal triggers. Common triggers include lack of sleep, high stress levels, flashing lights, or illness. Keeping a journal to track seizures and daily activities can help pinpoint what might be causing them. Making healthy lifestyle choices has a profound impact on prevention. Limiting alcohol consumption is crucial, as heavy drinking and withdrawal are known triggers. Avoiding illicit drugs is important for brain health. Managing stress through meditation, yoga, or breathing exercises can help calm the nervous system. By creating a routine that prioritizes rest and good nutrition, you provide your brain with the stability it needs, reducing the likelihood of electrical disturbances. Witnessing someone have a convulsion can be alarming, but knowing what to do can make all the difference. Your main goal is to keep the person safe until the seizure stops on its own. The first and most important step is to stay calm. Do not try to restrain the person or hold them down, as this can cause injury. Instead, gently guide them to the floor if they are standing and carefully roll them onto their side. This position, often called the recovery position, helps keep their airway open and allows any fluid or saliva to drain from their mouth, preventing them from choking. Once the person is safely on their side, focus on clearing the area around them. Move any hard or sharp objects, such as furniture, away to prevent injury from the involuntary movements. It can be helpful to place something soft and flat, like a folded jacket or a small pillow, under their head to protect it from hitting the floor. Loosen any tight clothing around their neck, like a tie or a tight collar, to ensure they can breathe easily. These simple actions create a safe space for the person while the seizure runs its course, minimizing the risk of physical harm during the episode. During the convulsion, it is critical to remember what not to do. Never put anything in the person's mouth, including your fingers, medication, or water. This is an old myth and is very dangerous. It can lead to chipped teeth, a bitten tongue, or a blocked airway. Also, do not attempt to give them CPR unless they have stopped breathing after the seizure has ended. Most seizures are short-lived, and the person will begin breathing normally again on their own. The best thing you can do is to be a calm and reassuring presence, observing the situation closely. As the convulsion subsides, stay with the person. It's helpful to time the seizure if you can, as doctors will want to know how long it lasted. After the shaking stops, the person will likely be disoriented, sleepy, and confused. Speak to them in a calm, reassuring voice. Stay with them until they are fully awake and aware of their surroundings. Do not offer them food or drink until you are certain they are fully conscious and able to swallow properly. Your supportive presence during this post-seizure phase is a vital part of first aid, helping them transition back to full awareness safely. The treatment for a convulsion depends entirely on its underlying cause. In an emergency situation, if a seizure lasts for more than 5 minutes, or if a person has multiple seizures without regaining consciousness in between, immediate medical intervention is necessary. This is a condition called status epilepticus, and it is a medical emergency. Paramedics and emergency room doctors may administer fast-acting medications intravenously to stop the seizure. The immediate goal is always to halt the abnormal electrical activity in the brain and ensure the person's breathing and heart function are stable. Once the immediate crisis is over, the focus shifts to long-term management and preventing future episodes. For those with epilepsy, this usually involves daily anti-seizure medications. Finding the right medication and dosage can sometimes take time, and it requires working closely with a neurologist. For seizures caused by other conditions, treatment targets the root problem. For instance, if a convulsion was caused by a brain infection, antibiotics would be prescribed. If it was due to a significant electrolyte imbalance, that imbalance would be corrected. The treatment plan is highly personalized to the individual's specific medical situation. You should always seek medical help after a first-time convulsion. A doctor will need to perform a thorough evaluation to determine the cause. This may involve blood tests, an electroencephalogram, also known as an EEG, to measure electrical activity in the brain, and imaging scans like an MRI or CT scan to look for structural abnormalities. It is also critical to call for emergency medical assistance if a seizure lasts longer than 5 minutes, if the person has trouble breathing afterward, if they are injured during the seizure, or if they have another seizure soon after the first one. These are signs that require immediate professional care. Ultimately, living with a condition that can cause convulsions is a journey, but it's one that can be managed successfully. With the right diagnosis, consistent treatment, and a strong support system, individuals can lead full and active lives. The key is knowledge and preparation. Understanding the nature of convulsions, knowing how to prevent them, and being prepared to respond correctly can empower both patients and their loved ones. There is hope and help available. By working with healthcare professionals and taking proactive steps, you can navigate the path to recovery with confidence and optimism, ensuring safety and well-being for the long term. Please don't forget to subscribe, like, comment, and share at OnyekaGOD-TV. Thanks for watching.